And welcome back to the special audience edition of Hannity. And Dr. Ben Carson is with us, and we're taking questions.
Doctor, in the 1960s, you had Ronald Reagan speaking out against socialized medicine for the AMA. The AMA made a complete 180 and was speaking out for Obamacare. What happened?
Well, first of all, only 23% of doctors belong to the AMA. And they go and they grab those ones and they say, this represents the AMA. Enough said.
Betsy?
I'd like to know how you would solve this problem as a doctor and also as President of the United States. Section 1311 of this law empowers the federal government.
Law.
The Obama health law empowers the federal government for the first time in history to dictate how doctors treat privately insured patients, even if you bought a plan like an Aetna plan or a Cigna plan and paid for it yourself. How will you protect that doctor-patient relationship?
Probably by rewriting that law.
Avik?
You're based in Baltimore, and you touched on Medicaid earlier, and as you know, the health outcomes of patients on Medicaid are a lot poorer than they are for private insurance because it underpays docs and underpays hospitals. But this is the big debate in states around the country, is whether they should expand their Medicaid programs as Obamacare requires them to do. If you were advising the governor of Maryland, what would you tell him to do with the Medicaid expansion?
Well, I would say we need to start talking about something that makes sense. You know, it doesn't make a lot of sense to invest a lot of our eggs in something that doesn't work.
Thank you very much.
Thank you very much.
Great honor to have you.
Absolutely.